Hello everyone and welcome back to the channel. Today we're tackling a topic that might seem counterintuitive, even a little controversial, but it's absolutely crucial for the well-being of anyone over the age of 70, or for those of you who have loved ones in that age group. We've been conditioned our entire lives to believe that more healthcare is better healthcare. That early detection is always the ultimate goal. But what if I told you that in your later years, some routine tests and screenings could actually cause more harm than good? That's right. The paradigm of one-size-fits-all medicine shifts dramatically after age 70. The very tests that might have saved your life at 50 could lead you down a path of unnecessary anxiety, invasive procedures, and even serious complications at 80. Today we're breaking down the 5 health checkups you should seriously reconsider and discuss with your doctor. This isn't about skipping medical care. It's about practicing smarter, more personalized, and ultimately safer medicine. So, please, before you make any changes to your health regimen, discuss this with your physician. This video is for informational purposes to empower that conversation. Let's get into it. Before we list the specific tests, it's vital to understand the why. Medicine for older adults isn't about chasing every possible abnormality on a test result. It's about balancing benefits and risks with a focus on overall quality of life. 2 key concepts guide this. Time to benefit. Many preventive screenings, like cancer tests, are designed to catch a disease early so you can treat it and live for decades. But if a disease grows so slowly that it would take 10 or 15 years to ever cause a problem, and a person has other health conditions that limit their life expectancy to, say, 5 to 8 years, then finding and treating that disease offers no benefit. The patient would likely die with the disease, not from it, but they would have suffered all the side effects of the treatment. The cascade effect. One simple routine test can sometimes trigger a devastating chain reaction. An ambiguous finding leads to a more invasive biopsy, which causes a complication, which leads to a hospital stay, which leads to delirium, a fall, or a hospital-acquired infection. This cascade can irreversibly diminish a person's functional independence and happiness. With that framework in mind, let's look at the 5 checkups to question. Checkup number 1. Routine PSA screening for prostate cancer. For decades, the PSA, prostate-specific antigen blood test, was the gold standard for men's health. But its utility plummets after 70. The harm. The PSA test is notoriously unreliable. Levels can be elevated due to a simple non-cancerous enlarged prostate, BPH, or even a recent bike ride. A high PSA often leads to a prostate biopsy, an invasive procedure that carries risks of bleeding, infection, and urinary incontinence. If cancer is found, the treatment options for older men, surgery, radiation, hormone therapy, carry significant risks. Permanent impotence, incontinence, bowel dysfunction, and cardiovascular complications. The smarter approach. For men over 70, or those with a life expectancy of less than 10 to 15 years, most medical societies like the American Geriatric Society and the U.S. Preventive Services Task Force strongly recommend against routine PSA screening. The goal shifts from finding every cancer to monitoring for symptoms that actually affect quality of life, such as painful urination or bone pain. Shared decision-making with a doctor is essential. If a man is 70, incredibly healthy, and has a family history of aggressive prostate cancer, the calculation might be different. But for the vast majority, the risks of the diagnostic cascade far outweigh the benefits. Checkup number 2. Universal mammography screening for breast cancer. This is a sensitive one, as mammograms have saved countless lives. However, the calculus changes significantly for women in their late 70s and 80s. The harm. As women age, breast tissue becomes less dense and often more fatty, making mammograms harder to read and increasing the rate of false positives. This leads to immense anxiety, callback appointments, ultrasounds, and potentially unnecessary biopsies. Furthermore, many breast cancers in older women are slow-growing, indolent. Treating them with surgery, radiation, and chemotherapy can be brutally hard on an older body, leading to a severe decline in function for a cancer that may never have caused a problem. The smarter approach. For women over 75 with no personal history or high risk factors, the evidence for continued routine mammography is weak. The focus should be on clinical breast exams performed by a doctor and, most importantly, prompt investigation of any new, palpable lump or breast change. The conversation should be about the patient's overall health and values. Is she prepared to undergo major treatment if a slow-growing cancer is found? For many, the answer is to prioritize vigilance over routine screening. Checkup number 3, routine cervical cancer screening, Pap smears. Many women are surprised to learn that they can finally stop getting Pap smears. The harm. The risk of developing new high-risk HPV, the virus that causes cervical cancer, is extremely low in women over 65 who have had a history of normal Pap smears. Continuing to screen offers diminishing returns. An abnormal result, which is often a false positive or a very slow-changing lesion, can lead to unnecessary and painful biopsies of the cervix, which carry their own risks of bleeding, infection, and psychological distress. The smarter approach. Major guidelines are clear. Women over 65 can safely discontinue Pap smears if they have had adequate prior screening with normal results and no history of precancerous lesions or cervical cancer in the last 25 years. This is one of the few areas in medicine where we can confidently say, "You're done." And it's a victory for preventive health. Checkup number 4, whole body CT scans or PET scans for full checkups. You've seen the ads. Get a full body scan and find disease before it finds you. For seniors, this is perhaps the most dangerous and predatory practice of all. The harm. These scans deliver a high dose of radiation, which itself is a cancer risk. But the bigger issue is the incredibly high rate of incidentalomas. Tiny, meaningless findings that will never cause a problem. Finding a small nodule on the lung, a spot on the kidney, or a shadow on the adrenal gland is incredibly common. But now you're on the hook. This triggers a terrifying and invasive diagnostic odyssey of more scans, biopsies, and even surgeries for something that is almost always benign. The psychological toll of this vague abnormality cannot be overstated. The smarter approach. Never get a CT or PET scan as a routine screening tool. These are powerful diagnostic machines to be used only when there is a specific symptom or a strong clinical suspicion of a disease. There is no evidence that whole-body screening benefits asymptomatic people, and overwhelming evidence that it causes immense harm through overdiagnosis and overtreatment. Checkup number 5. Intensive routine blood glucose screening for type 2 diabetes. Managing diabetes is critical, but the intensity of that management needs to change after 70. The harm. The standard goal for diabetics is often a very low hemoglobin A1C, a measure of blood sugar over time, achieved through aggressive medication. For a frail older adult, this aggressive approach is dangerous. The intense fear of high blood sugar leads to the very real and immediate danger of low blood sugar, hypoglycemia. For an older person, a hypoglycemic episode can cause falls, fractures, seizures, heart attacks, and severe cognitive confusion. The harm from one bad low can far outweigh the years of potential damage from slightly elevated sugars. The smarter approach. Diabetes management after 70 is about avoiding extremes. Doctors will often set a higher, safer A1C target, e.g. 7.5% to 8.5% instead of 6.5% to 7.0%, to drastically reduce the risk of dangerous lows. The focus is less on perfect numbers and more on feeling well, maintaining energy, and preventing symptoms like excessive thirst or urination. So if we're skipping these tests, what is the absolute priority for health after 70? It's not about searching for hidden problems. It's about optimizing and protecting what you have. Your annual checkup should focus on functional ability. Can you get out of a chair? Walk across the room. Cook for yourself. These are the strongest predictors of health. Vaccinations. Stay up to date on flu, COVID-19, shingles, and pneumonia vaccines. Their benefit is enormous and immediate. Fall prevention. Review medications that cause dizziness, assess home safety, and do balance exercises like Tai Chi. Cognitive health. Discuss any memory changes openly with your doctor. Social isolation and mental health. Loneliness is a health risk as deadly as smoking. Medication review. The most important one. Do a brown bag review with your doctor or pharmacist. Bring every single pill you take. The goal is often to deprescribe and simplify regimens to avoid dangerous interactions and side effects. Advanced care planning. Have the conversation about your wishes for care. Who will speak for you if you can't? This isn't about giving up. It's about maintaining control over your life and health decisions. So there you have it. The 5 checkups to avoid after 70 are not about neglect, but about wisdom. It's about shifting from a fear-based model of medicine to one of thoughtful, personalized care that prioritizes your quality of life today and every day. The single most important takeaway from this entire video is this. You must be your own advocate and have open, honest conversations with your doctor. Questions like, what is the goal of this test? What are the chances it will find something that needs treatment? If it does, what would that treatment involve? And how would it affect my daily life? Given my age and overall health, will this test help me live a better or longer life? Your health journey is unique. Empower yourself with knowledge, partner with a doctor you trust, and focus on what truly matters. Living well. If you found this video helpful, please give it a thumbs up and share it with your family and friends. What has your experience been with these tests? Let's start a conversation in the comments below. And don't forget to subscribe and hit the bell for more content aimed at living a healthy, empowered life at any age. Thanks for watching.